Swastiastu. Today, our group B6 will be presenting on our project titled Subcutaneous Mycosis. Before that, allow me to show our group members in the following slides. A very good day to everyone listening. I'm Christopher Widarsa with last three identity numbers 136, and I'll be discussing the first chapter of our topic. So, what is subcutaneous mycosis? According to the English lexicon, mycosis refers to any infection that is brought about due to a fungus. Trivial as it may seem, mycoses are infective and lethal enough to create 150 million cases and 1.5 million deaths in 2020 alone, which is not a small amount. That reason alone, in addition to the lack of attention that this silent devil gets, is why we believe that our focus on the project should be on mycosis. This brings us to the second half of the nomenclature, which is subcutaneous. As most would imply, mycosis can occur on different regions of the human body, starting from the outermost superficial layer onto the skin or the cutaneous layer, furthering profoundly into the deep tissue or the subcutaneous layer, and finally the organ regions known as the deep layer. For simplicity purposes, the division of fungal infection located around the subcutaneous region would be our main focus of this project topic. Lastly, as a general overview of the subcutaneous mycosis, the infection can be classified into three main categories, namely chromoblastomycosis, mycetoma, and sporotrichosis. Thank you for your attention.
Om Swastiastu. My name is Fiona Aurelia, and the last three digits of my student number are 125. In this part, I will be explaining about the problem formulation, purpose, and also the benefits of our student project. So the first is our problem formulation. So what is subcutaneous mycosis? And also what is mycetoma, sporotrichosis, and also chromoblastomycosis, and how to diagnose and treat it. And the purpose is, of course, to understand more about subcutaneous mycosis, also to know how to diagnose and to treat mycetoma, sporotrichosis, and also chromoblastomycosis. Next, the benefit that we hope we can give from this student project are to provide sufficient understanding of subcutaneous mycosis, their types, how to diagnose, and also how to treat them. And also, we hope that this student project can be a source of reference and input for further research. That is all from me. Thank you.
Okay, my name is Luh Putu Dinda Pramesti Sudastra, with my student number is 130. Okay, this is chapter 2. First, I want to explain about subcutaneous mycosis from the definition. Subcutaneous mycosis are a group of fungal diseases produced by a heterogeneous group of fungi, which involve skin, subcutaneous tissue, facial planes, bones, or various organ systems that leading to protracted clinical course and significant morbidity through fungal inoculation. Then, the characteristic of subcutaneous mycosis are: subcutaneous mycosis is usually sporadic and commonly found in tropical and subtropical area due to high temperature and humidity conducive to the growth of fungi. Subcutaneous mycosis usually asymptomatic, but in some rare cases, there is lymphatic and hematogenous spread of infection in immunocompromised hosts. The causative again is commonly found in soil, leaves, organic matter, and is followed by traumatic injury to the skin. And most of the fungi that cause subcutaneous mycosis can be cultured from infected tissue and identified by histopathological examination. Thank you.
Let me introduce myself. My name is Clairene Siemarga with last three digits of student number 134. Now I'm going to explain about classification of subcutaneous mycosis. Subcutaneous mycosis can be classified into several diseases, including mycetoma, sporotrichosis, chromoblastomycosis, rhinosporidiosis, lobomycosis, and zygomycosis or phycomycosis. This classification is carried out based on various aspects such as the cause of fungal infection, epidemiology, pathogenicity and etiology, and clinical features. For its characteristic, subcutaneous mycosis can be diagnosed and treated. The further classification of subcutaneous mycosis, based on the cause of the disease, mycetoma can be classified into actinomycetoma and eumycetoma. Actinomycetoma is caused by aerobic actinomycetes infection, while eumycetoma is caused by fungi infection. Zygomycosis or phycomycosis can be classified into mucormycosis and entomophoramycosis. Mucormycosis is a worldwide distributed mycosis associated with immunosuppression, whereas entomophthalma mycosis is a rare subcutaneous and mucocutaneous mycosis observed in normal immunocompetent hosts. Thank you.
Hello, my name is SGD B6 with 3 last digits of my student number is 139. So the first classification of subcutaneous mycosis is mycetoma. And now I will give you the general overview of mycetoma. So mycetoma is a skin and subcutaneous tissue chronic infection that is acquired by traumatic inoculation of the etiologic agent. Mycetoma lives saprophytically in nature, specifically in plants and soil, getting nutrition from organic materials in the decomposition process. Saprophytic microorganisms, specifically fungi or bacteria from plants or soil, can penetrate the skin and subcutaneous tissue by a mechanism called traumatic implantation. The infection slowly evolves and can invade deeper structures and other underlying organs, including the bone.
Om Swastiastu. My name is Caitlin Nataksha and my last identity number is 138. The diagnosis of mycetoma. Mycetoma can be diagnosed through several methods such as direct examination, culture, and biopsy. Direct examination is the most common way as it can be done even in areas with limited resources. Patients with mycetoma may appear with nodules, scars, and abscesses that drain serous material that contains the agents causing the disease. These features are mostly found in lower and upper extremities and neck. Meanwhile, grains are also one of the most common findings in mycetoma-positive patients. Grains can be diagnosed by direct examination and biopsy. But the gold standard of mycetoma diagnosis is culturing.
Om Swastiastu. My name is Zephania Ekklesia, and the last 3 digits of my student ID number is 127. And now I'm going to be explaining the treatments for mycetoma patient. The first treatment is antifungal drugs. Patients are usually given a combination of voriconazole and posaconazole, or patients can also be given any derivatives of azole drugs. The second treatment is surgery. There are several types of surgery that can be done to mycetoma patient. The first one is local excision. The second one is repetitive debridement. And the last one is amputation. Amputation is done to a patient if a part of a patient's body is totally damaged. And the last treatment for mycetoma patient is NSAID drugs. Since inflammation is the main concern of mycetoma, that is why patients are given NSAID drugs in order to reduce the inflammation.
Om Swastiastu. My name is Bonifasius with last student number 137. And in this occasion, I want to explain about sportricosis. What is sportricosis? Sportricosis is chronic or subacute infection caused by sportrix. And this disease can be found worldwide, especially in subtropical and tropical areas. This infection may happen by inoculation of plants, organic matter, and soil. This infection can infect both human and animals. And there are 2 forms of this disease. The first one is fixed sportricosis, or F, and the second one is lymphocutaneous sportricosis, or LC. Outdoor activities such as gardening, farming, animal husbandry can be the way of this infection. The clinical features of this infection typically present as pustules or papules that form ulcerous lesions involving local lymphatics. And such infections may involving bones, cartilage, muscles, fascia, etc. Thank you.
Om Swastiastu, my name is Immanuel Krisliandi, and the last 3 digits of my student number is 132. Now I'm going to explain about the diagnosis of sportrix. Sportrix can be diagnosed by swab examination, CT scan, X-ray, specific tissue examination, and magnetic resonance, depending on the clinical cases and the lesion location. And then for the mycological examination, there are 2 methods which divided into the first one is direct examination with sodium hydroxide and gram or GEMSA staining for the visualization. And then we have culture examination, and for the other methods such as non-culture examination, we can use specific anti-sportrix antibodies or ELISA testing. That's all from me. Thank you.
For the next materials. Previously, my name is Fauzan Azhima Mikajavani, and the last 3 digits of my student college numbers are 131. The treatment is, the choice of treatment depends on the clinical features of the infection, the species of sporotrichs, and immunological status, such as itraconazole, terbinafine, potassium iodide, amphotericin B, and deoxycholate.
Om Swastiastu. Hello, my name is Dhea Calista Putri with real last digit number 129. So I will explain about the general overview of chromoblastomycosis. First, we will talk about the syndrome. Chromoblastomycosis is one of the most common implantation fungal infection caused by traumatic injury and inoculation of microorganisms from certain group of Dermaticus fungi. And about the fungi, Fonsecaia pedrosi and Clada Piolopora carioni were the most common classification, followed by Piolopora filicosa and Fonsecaia compacta. And about the pathogenesis of this disease, the causative agent can enter through a transcutaneous puncture wound, usually through the part of the plant where the dermal lesion will form a cauliflower-like nodule. And about the clinical manifestation, this disease can occur in 5 different forms. First, nodular, tumor lesion, varicose, plaque, and superficial. And at an advanced stage, the spread of this disease forms satellite lesions. And last, about the spreading, this disease is a worldwide disease, but the higher prevalence it can affect is in a rural population in countries with tropical or subtropical climate, such as Madagascar in Africa and Brazil in South America. So that is all from me. Thank you.
Om Swastiastu, my name is Anak, Agung, Ayu, Kirana, Dharmautami, and the last 3 digits of my student number is 133. Today, I'll be presenting about the diagnosis and treatments of chromoblastomycosis. So in diagnosing chromoblastomycosis, we have to look for the presence of myriform or sclerotic cells, which are dark brown in color and are divided by a thick black septa. Now, to identify this, we have to take a sample of the infected site, or we can take a biopsy from the patient. Then we can take a 10% of potassium hydroxide solution and look at it under the microscope with the sample to clearly identify whether there is the presence of the myriform cells. Besides that, we can also use a duplex polymerase chain reaction in which we take the DNA of the fungi and do this test to confirm furthermore whether or not it is chromoblastomycosis. For the treatments, there are several drugs that can be used, but the 2 main ones are itraconazole and terbinafine, which can be used individually or in combination with one another. And amphotericin B and posaconazole can be used when both the itraconazole and terbinafine are not effective on the patient. Besides that, there are also physical treatments, which include cryosurgery, heat therapy, and also photodynamic therapy to treat chromoblastomycosis. That is it from me.
Okay, thank you for the opportunity. My name is Wilbert Purnamsidi with last 3 digits of my student number is 135. Now, we will go to the conclusion of this discussion. The first conclusion. Subcutaneous mycosis are a group of fungal diseases which involve skins, subcutaneous tissues, facial pans, bones, or various organ system that leading to a protected clinical course and significant morbidity through fungal inoculation due to injury penetrating into the skin. Second conclusion, mycetoma is a skin and subcutaneous tissue chronic infection that is acquired by traumatic inoculation of the etiologic agent. Mycetoma can be diagnosed through direct examination, biopsy, and culture. Treatments for mycetoma are antifungal drugs, NSAID drugs, and surgery. The third conclusion, sporotrichosis is a chronic or subacute infection caused by sporotrichs and typically present as pustules or papules that form ulcerous lesion involving local lymphatic. Culture and direct examination for this can be implemented for this diagnosis. Treatments for sporotrichosis are itraconazole, terbinafine, potassium iodide, amphotericin B, and deoxycholate. And the last conclusion, chromoblastomycosis or CBM is a fungal infection of the skin and subcutaneous tissues caused by traumatic injury and inoculation of microorganisms belonging to certain groups or dermatiosis fungi. CBM can be easily identified by the presence of myriform cells and is commonly treated with itraconazole and terbinafine. Okay, that's all from us. Thank you for your attention. Om Santi 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 Om.